So we're very fortunate to have two parents and one patient here in person. And then we have another adolescent patient who unfortunately was not able to be here in person, but prepared a brief video introduction. So you can kind of see what that is. I'd like to start by I'll call on each of you to let us know who you are, who your child is, and sort of a brief description of what their journey through congenital heart disease has been. Why don't we start with you, Lindsay? And give your name and...
Sure. Hi, everyone. My name is Lindsay Noyes-Vivacencio. My daughter, Aurora, we call her Rory, was born in 2020, and she has hypoplastic left heart syndrome. Yeah, and she's gone through all three surgeries, so Norwood, Glen, and Fontan. Yeah, 3 days, 3 months, and 3 years. So lucky number 3.
Yes. Yeah. And then Carissa, if you want to introduce yourself.
Sure.
My name is Carissa Ostrom. My son is 10 years old. He was born in 2015 with a bicuspid aortic valve, aortic stenosis, a VSD, and a brain bleed. And he received his Ross procedure in 2021 here at American Family Children's.
Okay, we're going to step away and have this brief video play. And is the volume up? The volume is going to fluctuate. I apologize. But we'll see if this plays.
Hello, my name is Oliver. I am a junior in high school. I play Ultimate Frisbee and recently earned my black belt in karate. My parents found out that I had a heart problem before I was born. My mom and dad were sad, and my big sister was just excited to have a baby brother. I had to be born early because my mom got sick. The doctors did a C-section. I was the perfect size. I was hooked up to monitors. I tried to eat and snuggle with my mom and dad. My surgery was canceled a few times because other babies were sicker than I was. My mom stayed near the hospital. My dad had to go back to work. My grandma stayed with my sister. After surgery, my surgeon decided it was safer to wait to close my chest. The first time my dad saw me after surgery, he was too shocked to go in my room. I got better slowly. The night after surgery, I needed ECMO. I used a breathing tube for weeks. I went through drug withdrawal. I had funny heartbeats, and I didn't eat well. I went home for the first time 70 days after I was born. My sister was so happy our family was together. My mom didn't remember what food my sister ate. My family had to learn how to live together at home again. When I was 5 years old, it was time for my big boy heart parts. One valve was too leaky, and one was too small. I was surprised that everyone did not get new heart parts as they got bigger. I took Blanky and Sarah, my penguin, to surgery. The doctors replaced one of my heart valves and tried to repair the other one. The replacement worked well. The repair came undone before I went home. I only stayed in the hospital for 5 days. When I got home, I had to be careful not to move too much. At first, it was easy to play quietly. After a while, I wanted to run and play. Everyone was glad when my 6-week recovery was over. Pretty. When I was 8, I got a robot heart part. It was time to replace my leaky aortic valve. I got a mechanical valve. I had my surgery at a hospital closer to home. I stayed in the hospital for 21 days. My sister and my friends came to visit. My parents took turns spending the night. Sometimes I did not want to do my physical therapy. I started taking a medicine called warfarin. It helps blood flow across my mechanical valve. It also makes me get more bruises. I have to check my blood every few weeks and be careful about getting bonks on the head. I missed a lot of ultimate practices at the beginning of my freshman year when I got my newest valve. I didn't like taking time off to recover, but my new valve helps me run farther. I did not need heart surgery. My doctor put a tube in my leg. There's 2 ends. He pushed my new valve through the tube into my heart. I spent 1 night at the hospital. My leg was sore and bruised for a few weeks. I liked going to the beach with my cousins. At first, my scars were dark pink. I used extra sunscreen and wore a rash guard. Sometimes kids ask about my scars. I tell them I got mauled by a bear. It's funnier that way. The bear is a silly story. I tell my friends the truth. My heart skipped beats after my 3rd surgery. I never fainted and my parents thought I was fine. But the skip beats made me feel funny, so when I was 15, I got a pacemaker. My heart doesn't skip beats now. Pacemaker is in my chest. You can see the bump when my shirt is off. My mom worries that I might get an infection on my pacemaker, so for some weird reason, she makes me brush and floss my teeth and go to the dentist to make sure that something inside of my chest doesn't get an infection. I go to a camp for kids with heart problems. It is called Camp O'Dana. I have gone to day camp, which is in the day, summer camp, which is in the summer and lasts a week, and family camp, which is in the winter and is 2 days and 2 nights. It's a weekend camp. I like to go to summer camp because the counselors are cool. I like the food, and I like the rock wall. It's very rocky.
Okay, so sorry he wasn't able to be here, but he wanted to share his story with you. I'm sure some of you can relate to some of the things that he talked about. And then finally, we have Andrew. And will you introduce yourself, please?
Yep, I'm Andrew Higgins, and I was born with tetralogy of Fallot. I had this repaired when I was 2 weeks old, 2 years old, 12 years old, and I got my ACD when I was 24. So I don't know any different. I feel fine.
Great. Okay, so the format of this session is if you have questions, I would love for you to feel free to raise your hand and ask them or type them in online. And I'm going to give a pause for a couple of seconds now to see if anyone has questions. If not, I have a list of questions that I thought people might want to know the answers to, and we can start with those, but I'll give it a few seconds. Yeah, can we have a microphone? Thank you. Oh, we have to use one of these?
Yeah, so no,
Oh, okay. Great, I did not know. Thank you.
Okay, this is for Andrew. Andrew, can you tell us how it was transitioning from the adult clinic?
My mom and my parents are here today, and we were talking through your presentation. My transition sucked. It was terrible. So I had the unfortunate experience of having an EP study at a unnamed hospital, and you hear the words that you never want to hear on the table. Oh, fudge. They didn't say fudge. I have a irregular femoral artery, and they tried to go through it normally, and they couldn't. So being awake on the table, hearing your doctor say, oh, fudge, and then leaving for half an hour to consult the experts, you guys, I finally got in with UW, and I've been super happy ever since. That answer your question?
Any other questions in the room? Okay. So this is actually for any of you. Have you or your loved ones had any issues with feeding, or did you experience delays in walking or talking or communicating? Can you talk a little bit about what that was like?
Yeah, so my daughter had a NG2 put in after she left after her first surgery. She pulled it out 7 times, which is 7 trips to the ER. So we eventually did get a G tube, which, we didn't really want that just because it was another surgery, but it was just the best thing ever. She was able to be fed. She was a nice, big, chubby baby, which I think really helped her for future surgeries. And then for kind of gross motor skills, we did not follow the instructions and did not do a lot of tummy time, which I regret because she actually never crawled. She took a long time walking. She did do butt scooting, so she got around when she needed to. That's kind of one tip I'd give to parents with babies is don't be afraid. They'll figure it out. Do the normal baby things for your baby. It'll help in the long run.
So my son was not born here in Wisconsin. He was born in Utah. And at the time of his discharge, he came home with an NG tube that they actually taught us how to place ourselves. So anytime he pulled it out, we would replace it at home, which was a really interesting experience. But for us at the time, it was put a lot on us on doing like his feeding care and kind of getting him out of his feeding tube on our own. We'd had a speech pathologist who would come to our house once a month to kind of see how things were going. And then we moved here when he was 6 months old, and things kind of completely changed. He no longer needed the feeding tube at that time, but development-wise, we were immediately put into Meritor's developmental program because he was a preemie. And so they were able to follow him and track him and work on like his PT and OT that he needed at home and in when we'd go to their clinics. And so that was really helpful on just kind of helping with his development because he was very delayed when it came to crawling and walking. He didn't start crawling until over a year old. And then we were thinking about doing PFOs, and then he started walking, thank goodness. But yes, developmentally, he had some struggles, and then now he's pretty on par with all of the rest of his peers.
So I didn't know this, but my mom did. I had trouble feeding as a kid, and I was very small, didn't want to eat, very underweight. But eventually, well, I learned to eat. But before my 2-year surgery, I needed to fatten up a bit. So mom and dad would make me malted milkshakes virtually every night. And I still love them. Other than that, I think my development was pretty typical, which was pretty lucky.
Thank you. Any questions? Can we take a microphone up there? Great.
My question is for Andrew and maybe a little for your parents. I'm wondering what their involvement is like in your healthcare at this point.
As of right now,
Yeah.
they're always there if I need them. But otherwise, I take care of it most of myself.
I could add. I mean, for those that are going through it, you are your own best advocate. And, you know, it was very important that Karen and I, of course, when Andrew was a tot, we fully understood everything. And we, you know, of course, it carried that through with the multiple surgeries and beyond just the heart repairs, the massive headaches that he had, and the behavioral issues and, you know, getting bullied and whatnot in school and all those psychological issues. You need to stay on top of it, and you're the best advocate there because we're the glue that remembers everything that he couldn't possibly have remembered. And, you know, understanding what happened back then and where he's at today. And so when he goes in, he's, what are you, Andrew, 34 now? 34? Something like that. You know, we still consult and confide, and it's important to have a team that all understands it. So hang in there. Yeah, here we go.
Hi, Andrew. What was middle school and high school like for you academically?
Academically, I was fine.
Awesome.
I didn't have any IEPs or 504s or anything like that. Okay. And I got through just fine.
Excellent. Did you do schooling after high school?
Yeah, I went here to the University of Wisconsin. Awesome. Graduated here, and I actually work here at the Weissman Center.
Do you feel like your history inspired you to pick a career path that, you know, it's just, you know, because of everything you went through?
Kinda, but not really. I was always good with math and science. So that's what led me down that route. And then just through wonderful chance, I met my boss now, and I've been employed with him since sophomore year of college.
Excellent.
Okay. Did you ask any questions? Was that? No? Okay, great. So we'll just kind of move through the progression of the presentations that we gave with related questions. Have you or your loved one had any mental health concerns like anxiety or depression? And or separation anxiety that's more extreme than you might expect? And can you share a little bit more? Or ADHD?
Sure. So my daughter's pretty young. Obviously, she's only 5, but we have kind of noticed more anxiety than we're expecting. So pretty early on, we have her seeing some therapists right now, and we'll kind of see how it goes. But I was telling Auburn earlier, it's hard to tell, is it normal or is it because there's something else going on? So that's always kind of the question of, is this normal, or maybe it's being caused by something else? So kind of always taking the more conservative approach, I think, is a good idea in getting things checked out.
And does she have siblings that you can compare her development and her anxiety levels to? So you know.
She has 2 older brothers, and I'd say they're kind of opposite spectrums on that as well. My one son, nothing phases him, and my other one, somebody eats his ice cream and it's just a full-blown temper tantrum. So again, it's kind of hard to tell, is it her, is it just all kids are so different?
My son has everything. So he has depression. He's 10. He has depression, anxiety, ADHD. All of my boys in my family have ADHD. So that was kind of a given. But for us, we've seen a lot of issues when it comes to like coming into clinics or having procedures or things like that. So we have taken steps to implement, like making sure Child Life is involved. Child Life had to meet us at the door one time. But so just making sure that we've had things in place for him that kind of help him. He sees a therapist. The school is actively involved, and they do depression checks on him quite often, just to make sure that things are going well with school. He's interacting with people. They've implemented programs at the school so he can make friends and have connections with people. So it's been kind of really good to see that things are kind of in place for him, but it's also been a really long advocacy process and making sure those things are implemented for him.
Before you pass the microphone off, can you talk a little bit about how you've been an effective advocate for your son in those settings?
I think everyone dislikes me, but no. I think so. For a really long time, I have been a huge advocate for my child and just kind of, making really good friends with the administrators at a school early on, even when we were in the 4K program, just being like, hey, here's my kid, here's everything. Before the school semester even starts, he's still in elementary school, I sit down with his teachers and the school administrators to be like, hey, this is my kid, this is how, here's all this stuff, making sure it's all in place. That'll be different when it gets to middle school, so we'll tackle that when it comes to there. But I try and be really proactive in how I talk to the school and make sure they're aware. I submit, anytime we have a clinic appointment, I submit all the documentation to the school about what happened as well, just so that they're aware and they can be notified of any changes that happen.
So I was never diagnosed with any mental health anythings. And that's just how I was. I didn't know any different. So as Dad said, the picking on at school and stuff, I thought that was just normal. Also back in the day, we didn't have all the mental health resources that we have now. The ones that I do have, I have a little bit of anxiety now, but I do not attribute that to my heart because I know that we have a long family history going up and sideways with my siblings, up with parents and all that. Other than that, I don't think there was any mental effects of my disease. I feel sorry for you. Your son doesn't want to visit the doctor. I never had an issue with that because it's just what you do. So, yeah.
Andrew, thank you. I have a question for you, which is, and I just lost it because my phone started beeping. Were there any questions that kids asked you when you were growing up about your heart, like they saw scars, and how did you respond to that? And did your parents help you with that at all?
They would help any way I needed. Nobody really asked because I never really told anybody. It never really came up. It's just, you can't run very far? No, I just don't run. And they left it at that.
Yeah. And I wonder, Lindsay and Carissa, do your kids seem to just think this is normal, this is how everybody lives? Or have they said things to you that let you know that they're aware that there's something different about the sort of care and needs that they have?
Yeah, I think the physical effects, like the scar, isn't really discussed too much in our house. It's just kind of normal. I think my daughter does get frustrated when she can't keep up with friends. If they're at the playground and she can't run as fast, and we kind of have to explain, well, you have a special heart and you take a little bit longer, but that's okay. Beyond that, nothing yet.
This is a weekly occurrence in my house sometimes. A lot of times, especially if something happens at school or, we're getting ready for another doctor's appointment, and thankfully they've kind of transitioned to only like once a year now. But he will definitely be like, why did this happen to me? Like, why do I have to do this? Why does this? On the other spectrum, his brothers are like, well, why don't we go to the doctor as much? And I'm like, or, hey, he got a whole bunch of Legos. I'm like, well, there's some give and take with that. So I have seen like it is very much a forefront in our house on like his defect and what it's about. He's become really good at kind of advocating for himself and letting his classmates know what's going on, especially when they do like swim units. And he's like, I want to wear a rash guard. And then people ask him about his scar and his pacemaker and all these different things. So I think for him, he's kind of open to talking about it, but it also is like a weekly conversation of like, why me? And why do I have to go through this?
So complete opposite end. She didn't talk about it very much, just in general. But I've had more questions with my children now. They ask, Daddy, why do you have a scar there? Well, blah, blah, blah. Or when we read, I'll have my son lay on my side and, Peter, you can't lay on that side. Oh, right, you have a piece of metal in there. And of course, being 4, he doesn't remember, so I have to tell him each time. But they've actually asked more questions than I think any of my friends ever did.
Pausing to see if there are any questions from the audience.
So my daughter is I don't tell people to type of child, and I'm curious how you feel about that now, like in hindsight, looking back. If there's a part of you that's like, well, maybe I should have told people, if you feel like that was the right approach for you as a kiddo.
Yeah, for me, I think it was fine. I didn't want to be called out as special. So I would just try to be like everybody else. Just not being able to run.
I think it's interesting how all of our kids are unique and special, and they all have their own approach, and we all have our own parenting styles. And so that's why I'm so glad that we have the true experts here to talk, and you as well, to talk about what approach is working for you and what questions you have. Are there things that you feel like either you, either as a parent or as a patient, have unique insights into that other people don't have as a result of your experiences with congenital heart disease?
I think that's happened.
Me too, I got consultants.
I can talk about it.
I think for me personally, my son's journey truly changed the course of my life, and some of the people here can attest to that. I work with nonprofits. I work with the American Academy of Pediatrics. I work with CNOC, the Cardiac Neurodevelopment Outcomes Collaborative, on many different projects. So I think my insight in how to advocate for my son, a lot of that has come from working on these communities and working with these different providers to be able to see how different places are operating and what I can do to be a better advocate for my child and what he's going through.
I think the only thing that comes to mind is when I was pregnant, it was a really hard time because we knew about Rory's situation, and just like different things that people would say to you of like, oh, is it a boy or girl? Oh, it doesn't matter as long as they're healthy, right? And you're like, but they're not healthy. And I think just certain things of kind of putting yourselves in people's shoes of like, well, maybe something's not going, okay in their life, and they're not excited about their pregnancy because, you're supposed to be really so excited to have this baby, and it's such a stressful time, and kind of understanding that everybody's pregnancy is different, and some children are wanted, but there's a lot of anxiety that goes along with that too.
I don't have anything to add.
Okay, thank you. Any questions, follow up? Okay. Is there something that you wish you could tell teachers or schools or employers?
I think for schools, just, obviously we talk about their condition and it's really scary. I know I've scared a couple of teachers of like, well, what happens if, her lips turn blue or she has trouble breathing? We'll call the ambulance, right? And that's a terrifying thing, I'm sure, as a teacher and educator to have to hear. But I think the other aspect is like, they need to be pushed, they need to do exercise. They need to be able to try to keep up with the other kids, because in the long run, that's what's going to help them health-wise, is that exercising. And even if they struggle with it, as long as it's not completely overdoing it, kind of stretching them to keep up with the other kids is what's going to help them in the long run.
I think for me, I always try and make a note that like he can be normal. He has no limitations. He can play sports, he can, play drums or whatever he's interested in at the time, and to really make sure that no one inhibits in what he wants to do. So whether that be at school, like let him try it, let him do it, he'll let you know, like, if it's too much. At home, we're like, you can do whatever you want, just try not to wrestle as much. Protect that pacemaker. But other than that, we try and advocate for him to have as much as a normal life outside of the hospital as possible.
Yeah, that's been my experience. Just try to be as normal as you can. I never asked for any special accommodations except for running the mile. Other than that, everything was pretty normal.
And I think kind of as a follow-up to that question is, how do you find support in your life? Like, who or what supports you in taking care of your child, or in your life in general, or in just living your life fully?
I think absolutely family. I have a huge support system. My parents actually lived in town, and so when my daughter was in the hospital all 3 times, my boys went to live with my parents. And then just having somebody that you can be able to trust that they can handle that aspect of your life so that you can handle this aspect of your life was essential. And obviously my partner was a big help too. When I got the diagnosis, I kind of shut down. I did not want to talk about it. It was like something that I knew was happening, but I could not deal with. And he was the one who did all the research, made sure we had the doctor appointments scheduled, make sure that we were going through all of that. So
I'm going to put a couple plugs in here. Campo Dan has a great program with supporting, like, they have a mom's weekend, they have a dad's weekend, they have family camp, they have summer camp, they have winter camp, and it's a really good way for families to get connected and involved with each other, especially in this area. I think for me, like, having my group of friends who I can just message and be like, hey, this is what's going on. My family, of course, will, at a drop of a hat, fly out here from Colorado to, like, help support if it's ever needed. So those are the things that have really helped me kind of on this journey.
Yeah, to echo what both of you said, family is the biggest supporter. I couldn't have asked for a more supportive family. But in addition, faith. I got to put my faith in God and know that He's going to take care of me. So it's faith and family.
This is another plug for Campo Dan, because I have met some of my best friends through Campo Dan, and these women, we've been through a lot together, kids' surgeries and
divorces and parents dying, and we've always supported each other, and we know we have each other's backs, and all of that's because of Camp O'Dayan. We all took a whim, went to Camp O'Dayan by ourselves as heart moms and found each other. So, and we happen to all live near each other, which is even more phenomenal. So.
I think each of us goes through a unique journey with our children, and as children grow up, they continue on their journeys, and it's fun to watch them fly and to succeed and to carry on with the things that bring them joy in their lives. Andrew, I think I want to ask you specifically, are there things about your health that make you anxious, and sort of what do you do about that? And you kind of touched on this a little bit in talking about some of your experiences that weren't ideal, but.
Yeah, the non-ideal ones were, stressful at the time. But now that I've got a great care system, I really don't have any worries about my future health. It's more for my family, especially my wife and kids. What if something happens to me? What will they do? But for me, myself, I do as much as I can, and the rest is, it'll be what it'll be.
Thank you. Are there any things the three of you want to share with the people who are listening here or online that I haven't asked about that you feel are important things to talk about?
I think as parents, having a child with any kind of health issue is just such a huge thing, and it's really hard to think about anything else besides that. So I think it's important to know that it's okay to not feel okay. It's okay to feel like you don't have it, and it's really hard. And try to focus on whatever is going to get you through like the next hour, the next day, the next week, and just knowing you're going to get through this. It's going to be okay, but trying to find something that kind of take your mind off of the anxiety is important.
Just be your own health advocate. As my dad said, you have to be your best advocate, or your parents if you're at that age. Because not that the other doctors don't care, they definitely do. They just don't have all the knowledge that they might need. So you have to be the one to bring to them, hey, by the way, remember, I had this giant heart disease and you can't go through my femoral artery. Just be your own advocate and don't just trust the system. Make sure that, you're checking in on it to make sure that it's actually doing what it's supposed to.
I want to give a huge thank you to our panelists for coming and sharing their stories. It's hard to, sometimes it's hard to talk about personal things and personal health things, but I really appreciate their honesty and transparency, and all of you for joining us today in this event and sharing your experiences as well and connecting with other people. I'd also like to give a huge shout out to all of the people who came and presented today and took time out of their Saturday away from their families to come join us in helping our patients who we care for and who we care about understand the resources that are available to them and to understand how normal their journey is for what their child has gone through or what they've gone through. So can we have a big round of applause for everybody? And then feel free to stick around for a little bit. There's still some food out there. I think our resource folks, who included Tim from the Wasteman Center and the Way Forward that has resources around the county and South Central Wisconsin, if you're interested in connecting with those for your family. There's someone representing Camp O'Dayan. They have a table. Carissa's representing Conquering CHD, which is a national education and advocacy organization, and Lindsay and Auburn are here for our Parent and Family Advisory Committee for our Congenital Heart Program if you want to learn more and make your voices more heard. So thank you again for coming.